Bone health occupies a peculiar position in the hierarchy of health concerns people think about as they age. Unlike conditions that announce themselves with immediate symptoms, osteoporosis develops silently over years, quietly weakening the skeletal structure until a fall produces a fracture. The statistics underscore the scope of the problem. 1 in 5 women over 50 will develop osteoporosis, making it a majority-level risk that warrants proactive attention. The conversation around bone health typically centers on calcium supplementation and prescription medications, but the foundation of skeletal strength begins with nutrition. Higher bone density correlates with improved lung function, reduced back pain, and even decreased risk of hearing loss. Understanding which foods deliver the most meaningful support for bone health makes it possible to build a diet that protects skeletal structure without requiring dramatic dietary overhauls. Dairy foods, the calcium and vitamin D foundation. Calcium and vitamin D function as the primary nutrients for bone tissue. Calcium provides the mineral density that gives bones their hardness, while vitamin D regulates calcium absorption. Without adequate vitamin D, even high calcium intake fails to translate into improved bone density. Low-fat dairy products including milk, yogurt, and cheese deliver both nutrients in a bioavailable form. Research found that maintaining adequate vitamin D levels daily reduces fracture risk by 33%. The specific pairing of protein and calcium, both present in dairy, reduces fracture odds by an additional 33%. For women between 51 and 70 years old, the recommended targets are 1,200 milligrams of calcium and 800 to 1,000 international units of vitamin D per day. Fortified dairy alternatives like almond milk and soy milk serve as viable options for people who do not consume traditional dairy. Prunes, the polyphenol-rich bone protector. Prunes carry a reputation primarily tied to digestive health, but their relevance to bone density is significant. The mechanism involves polyphenols, plant compounds that exert anti-inflammatory effects. Chronic inflammation contributes to bone loss by activating osteoclasts, the cells responsible for breaking down bone tissue. Research at Penn State tracked postmenopausal women who consumed 4 to 6 prunes daily. The results showed maintained bone density, preserved bone structure, and mechanical strength. The dose matters. The protective effects appeared at 4 to 6 prunes per day, not 1 or 2. Chicken and egg yolks, the vitamin K2 connection. Vitamin K2 receives less attention than calcium and vitamin D, but its function is equally essential. While calcium provides the raw material and vitamin D regulates absorption, vitamin K2 activates proteins that bind calcium into the bone matrix. Without adequate K2, calcium may circulate in the bloodstream but fail to deposit where it is needed. Chicken and egg yolks rank among the richest dietary sources of K2. Research followed women who supplemented with MK7, a form of K2, for 4 years, and found bone density improvements of up to 40% compared to those who did not supplement. Tomatoes, the lycopene effect. Lycopene, the carotenoid that gives tomatoes their red color, influences bone health through its effect on osteoclasts. Lycopene inhibits osteoclast activation, shifting the balance toward bone preservation. Research found that diets high in carotenoids correlate with higher bone density measurements. An important practical detail: lycopene becomes more bioavailable when tomatoes are cooked. Tomato sauce and soup deliver more lycopene per serving than raw tomatoes. Adding a fat source like olive oil further enhances absorption. Beans, the plant-based calcium source. White beans deliver approximately 13% of the recommended daily calcium intake per cup, along with magnesium and zinc, 2 minerals that support bone structure. Cooking beans improves the bioavailability of these nutrients by breaking down phytic acid, a compound that binds minerals and prevents their absorption. Research documented that cooked beans allow significantly better calcium, magnesium, and zinc absorption compared to raw legumes. This makes properly cooked beans a viable component of a bone-protective diet, particularly for people who do not consume dairy. Leafy greens, the vitamin K source. Leafy greens including spinach, kale, collard greens, and turnip greens rank among the highest dietary sources of vitamin K1. Vitamin K1 contributes to bone health through its role in activating osteocalcin, a protein that regulates calcium deposition. Research found that adequate vitamin K intake correlates with reduced fracture risk. People who consistently meet vitamin K recommendations have measurably lower fracture rates than those with insufficient intake. The recommended approach is to consume 1 cup of raw leafy greens or half a cup of cooked greens daily. Soy. The phytoestrogen factor. Estrogen plays a critical role in maintaining bone density. The decline in estrogen production during menopause is the primary driver of accelerated bone loss in women over 50. Isoflavones, plant compounds found in soybeans, function as phytoestrogens, producing weak estrogenic effects. Research in Japan found that regular intake of soy isoflavones helps prevent bone tissue breakdown in postmenopausal women. Soy milk, tofu, tempeh, and edamame all deliver isoflavones. Current research suggests that moderate soy consumption is safe for most people and may offer protective benefits for bone health. Fermented foods. The probiotic pathway. The gut microbiome influences nutrient absorption, inflammatory signaling, and immune function, all of which affect bone metabolism. Lactobacillus rhamnosus has been shown to influence bone density through mechanisms that involve reducing systemic inflammation. Research found that daily supplementation with L. rhamnosus increased bone mineral density by 36% and reduced joint stiffness by 42% over 6 weeks. Fermented foods including sauerkraut, kimchi, kefir, and certain yogurts naturally contain L. rhamnosus. The key is choosing products that contain live active cultures. Wine, the moderate alcohol consideration. Moderate alcohol consumption, defined as up to 1 drink per day for women, has been associated with reduced bone turnover and increased levels of osteocalcin, a marker of bone formation. Research found that postmenopausal women who consumed as little as half a glass of wine daily had measurably less bone loss compared to those who abstained entirely. The practical takeaway is not that people should start drinking for bone health, but that moderate drinkers who already consume wine in small amounts do not need to eliminate it. The emphasis remains on moderation. Higher alcohol intake is harmful and increases fracture risk. The foods that support bone health include common items like dairy, eggs, chicken, tomatoes, beans, greens, and fermented foods. The key is not to focus on a single nutrient, but to build an eating pattern that consistently includes multiple sources of the vitamins, minerals, and bioactive compounds that support skeletal health. Bone density responds to dietary changes throughout life, and the rate of loss can be slowed through targeted nutrition.